Thanks for joining us at UCSF Health as we discuss food safety after transplant. Following strict food safety guidelines is critical for maintaining your health after receiving a transplant. After your surgery, you will be prescribed an immunosuppressive medication regimen that weakens your immune system to prevent organ rejection. But having a less efficient immune system means that there's a higher risk of contracting a foodborne illness from foods that are undercooked or prepared in an unsanitary environment. Strict food safety practices can help to minimize this risk of infection and protect you and your new transplanted organ. The first line of defense when it comes to food safety is good hand hygiene. Always wash your hands before preparing a meal, before eating, or any time when you may be putting your hands close to your face or mouth. Always wash your hands after using the bathroom, after covering a cough or a sneeze, or after touching any surface that may be unclean. Be sure to wash using hot water and soap for at least 30 seconds. Try singing happy birthday to yourself as you wash your hands to ensure you're meeting the full 30-second duration. When cooking, be sure that all of your cookware and kitchen surfaces are clean and sanitized. Whenever possible, use a dishwasher to clean dishes and cookware using the sanitize setting. If you don't have a dishwasher, just be sure to wash your dishes with soap and very hot water, as the high temperature is most important for killing bacteria and other organisms that can make you sick. Old and worn out wooden cutting boards are difficult to clean and can hold on to bacteria more easily. So it would be best to replace them with new cutting boards made of plastic or silicone. Try having separate cutting boards for meal preparation, one for meats, one for fruits and vegetables, and one for all other foods to prevent cross-contamination between ingredients. It's perfectly safe to have raw fruits and vegetables as long as they're of good quality and washed thoroughly with cold running water. You do not need to wash your produce with soap, bleach, or any other cleaners. Be sure to wash all fruits and vegetables that you purchase, even pre-washed vegetables and salad mixes from the grocery store. Try to avoid raw fruits and vegetables when dining out at restaurants, as these foods are safest when enjoyed at home, where you can wash and prepare them yourself in a sanitary environment. All meats, eggs, and seafood must be fully cooked in order to be safe to eat. So raw meats, raw seafood, and uncooked eggs must be strictly avoided after transplant. Meats that are frozen, brined, cured, or pickled may still contain pathogens that can cause foodborne illness, so these items must be heated to their appropriate temperatures before consuming. Purchase a food thermometer for home to check the temperature of any meats you are preparing. Different meats may have different minimum temperature goals to be considered safe to eat. See your transplant binder for a detailed guide. When dining out at restaurants, order meats medium well or well done. Heat deli meats and cold cuts when preparing a sandwich. Pasteurization is a process in which certain foods are flash heated to eliminate any harmful organisms without actually cooking the food itself. This makes them safer to eat for patients who have undergone an organ transplantation. Try to buy pasteurized eggs and products made with pasteurized eggs whenever possible, such as mayonnaise, Caesar dressing, or eggnog. Some grocery stores may carry pasteurized shell eggs, which are clearly labeled pasteurized and have been treated to eliminate any harmful pathogens. These types of eggs can be safe to eat even with a runny yolk. Otherwise, all other eggs need to be fully cooked with a solid yolk in order to be considered safe to eat. Never buy any dairy products that say raw milk or unpasteurized, as this means that they may still contain pathogens that lead to foodborne illness. Most dairy products at the grocery store are pasteurized and should be labeled as such, but specialty stores and farmers markets may carry unpasteurized goods. Restaurants are safe to eat at as long as they have good food safety inspection scores. These scores are often displayed in the restaurant itself or can be found online. The criteria for scoring may vary by county, so look for your local Department of Health website to find the inspection score of your favorite restaurants to make sure they meet the mark. Typically, a safe restaurant will have a score of 95 or above, or an A rating. Certain fruits, such as grapefruit, pomelos, Seville oranges, pomegranate, and starfruit, contain compounds that may interact with your transplant medications, leading to dangerously high or dangerously low levels of the drug in your blood. These fruits and any products made from them should be strictly avoided. Luckily, all other fruits are safe for you to enjoy after transplant. It takes a bit of time and investment to make lifestyle changes after transplant, but the benefits are well beyond just protecting your organs. These changes promote good overall health and a longer life. Your registered dietitian is available to continue education about food safety after transplant.